Harriet Dodd has been a healthcare assistant at the Royal Sussex County Hospital in Brighton for 3 years, as well as a St John's ambulance volunteer. She has seen firsthand the effects of Covid-19 on hospital staff and resources since the start of the pandemic. Speaking in a personal capacity, she told me what things are like inside the hospital now compared to before the outbreak of the virus.
So currently this week we're working with 270 COVID patients in the whole hospital, and about 40 of those are in intensive care. This number has increased rapidly, so in the last week in January it increased from about 170 patients to 240, which was the biggest increase we've seen since the beginning of the pandemic. There's been a big rise in cases, and I think that's nationwide, especially after the Christmas break. There's definitely been a big increase. That said, back in March and April we weren't perhaps catering for as many, weren't able to cater for as many because we just weren't sure of the increases that were going to happen. So from a numbers point of view, I think the situation is worse. We can see that in the statistics, we can see that in the local area as well as in the hospitals. That said, our position to be able to help those patients, I think, has also improved. To begin with, I think we were seeing a lot more older patients, kind of the 70, 80 upwards bracket. Unfortunately, we're now seeing 30, 40, 50, 60-year-olds coming in, and they're coming in with quite severe symptoms. I think potentially being able to see from your own perspective that the situation in hospitals isn't as nice and isn't as easy and isn't as relaxed as some people are making out would definitely change people's opinions for sure. We're expecting to roll out a significant proportion of vaccinations within at least 3 months. It looks as if the vaccine is going to be our key way out, and a very, very big part to play in that.
In the midst of the third national lockdown, the numbers of COVID-related deaths have reached record levels per day within the UK, but the vaccination brings hope that this may be the beginning of the end.